Welcome to your program of choice, Health Affair on AIT. I am a regular anchor, Ushuomowa Danes. On the program, we focus on critical health issues, challenges of women and children with a view to finding lasting solutions. On today's episode, we'll be focusing on arthritis, which is also known as inflammation of the joints. But before then, let's bring you news about events that shaped the health sector globally and nationally in the last 1 week.
Bernard Enyia is the Secretary General Diabetes Association of Nigeria. He has lived with diabetes for 13 years.
Diabetes is a Herculean task because for now, diabetes have no cure, and it is very expensive to manage diabetes. Our tests we pay, but other diseases like HIV is free. Our drugs are very expensive.
Diabetes mellitus is a metabolic disorder that causes an increase in blood sugar, leading to several complications if not properly managed. The situation of Bernard represents that of over 20% of Nigerian population living with diabetes and another terminal disease, cancer. The good news is that these twin non-communicable diseases and several others are preventable with lifestyle modification and relevant policies.
It's really important that we look at food quality control policies. There are so many alien practices that are coming into our food practices and food control. You buy food from the market, you don't know whether it has been preserved with kerosene or with hydrocarbons. And these are practices that are alien to us. What of the issue of plastics? You have plastics seeping into water, and all that causes have carcinogens within them. Well, the substances that cause cancer or promote cancer.
Sugar-sweetened beverages. They keep loading most of the product we eat in the open market with a lot of sugar without regulation at all. The government should legislate and make a policy that all the companies that are producing all the sugar-sweetened beverages, they should tax them so that this excise duty tax, a percentage should be taxed on them so that they use that money now to take care of those of us who are already victims. Obesity and every other disease that is propelled by all this excessive eating of sugar.
Can be, lifestyle induced like type 2 diabetes. They are preventable. So it's about the education, it's about the prevention, it's about early detection and diagnosis and management, awareness, compliance, focus, and also for the healthcare professionals to come together and find a way of involving those who somehow have, are either diabetic or they've got cancer, to be involved in the solution. That way, we'll have the sustainability that we desire and that we are looking for, around non-communicable diseases.
To our silent killers, diabetes and cancer, despite their huge burden, according to some experts, have not been given the desired attention by relevant authorities compared to COVID-19, HIV, and others. Cervical and breast cancers are generally global health concerns, particularly in developing countries like Nigeria, where the World Health Organization has made a prediction that by 2025 to 2050, almost 1 billion deaths will be attributed to cancer. In other parts of the world, where cancer is also a big issue, they have found a way of preventing this death by organizing regular screening for early detection.
One of the tools that's available is regular screening. Emphasis on regular, not just one-off, but end-stage presentation is usually what we see in clinics when it's already stage 3, stage 4, when women are already having those symptoms. By the time you're already having symptoms, the breast is swollen, there's a sore, there's a wound on it, it's already too late. By the time a woman is bleeding after intercourse, she's bleeding everywhere, every day, it's already too late. So the best time for a woman to show up is when there are no symptoms. And that's why over 200 women are turning up today with no symptoms. And we want them to do that every time we do this screening program.
The program that recorded over 200 beneficiaries is expected to continue in other parts of Lagos, like Lekki, Ikorodu, Ebute-Metta in July 2021.
In the course of a woman's reproductive life, she should be able to attend cancer screening at least every 3 years until she's 65. We don't have such policies, we don't have such public health programs instituted in our country yet. And that's why it gladdens our heart that as an organization, as an NGO, we are supporting government, and government is partnering with us. Lagos State government, through the Lagos State Lotteries Board, had sort of supported this initiative to take this program to different communities in Lagos State. We cannot do all of Lagos at the same time, but we intend to do this on a roadshow where we visit your community, you gather the women for us, we partner with the local government. So this is happening in Lagos Island East LCDA.
We found that women basically contribute 50% to the global population, and even here in Nigeria. And we find that women are still disenfranchised from accessing quality health care. And when it comes to cancer-related diseases, women are still the ones contributing the most to a lot of these cases, the new cases. And even hearing from Dr. Laleye, he said that through thorough research that a woman dies every hour due to cancer. And one thing we've not really imbibed as a habit, especially women, is to go for preventive checks, go through health checks, health screening. They'll rather just go and hustle, put food on the table, manage the home. But the thing is, once they find out that they have cancer, it's almost like a death sentence. Because at that point in time, maybe it's at stage 4, it's terminal, and there's really no hope. So we're partnering with the Optimal Cancer Care to provide this free screening, breast and cervical cancer treatment for these women. We're happy to do this again. We did this last year.
This is a good program for our women to take advantage of towards making a test or checking of their health care, particularly as regards cancer, which is a very, very dangerous disease. And this program is coming at a free rate for everyone, particularly the women in Lagos Island East.
I want to appreciate Lagos State government and all the sponsors. Thank you for bringing out something like this for the women, because it will go a long way to really let women know about their status and to fight against cancer.
The organizers, in partnership with Lagos State government, also called on parents to take advantage of the cervical cancer vaccination for their female children before they become sexually active.
Vaccinate while they are currently sexually active and then screen them. Okay, obviously vaccines are very expensive, and we don't expect everybody to get vaccinated at the moment. However, it's affordable for those who want to take it. It's roughly about 10, 12, 13,000 naira in some locations. We can subsidize it. We can get partners to subsidize it. We subsidize it for children on Children's Day, because children from the age of 10 can take these vaccines.
With the human papilloma virus, which causes cervical cancer, being transmitted sexually, the men were charged to protect their wives by reducing their sexual partners.
PV is sexually transmitted, so lifestyle changes can actually reduce the risk to the woman and, more importantly, to the man. But the biggest risk is to the woman, because a woman bears the brunt of the promiscuity of the man. So again, this might be a message to the men and say, look, reduce the number of sexual activity and sexual partners, and therefore you can reduce the spread.
With the economic impact of the COVID-19 pandemic on all sectors of global economies, the theme for the 2021 Nigerian Optometric Association National Conference, Quality Eye Care, Economic and Security Impact of COVID-19, for many was art.
To welcome you all to the 44th Annual National Conference and Expo of the Nigerian Optometric Association. In spite of the great challenges and setbacks occasioned by the COVID-19 pandemic, I'm most grateful to God Almighty for keeping us safe and making it possible for us to converge in this beautiful city of Lagos, the center of excellence.
COVID-19 pandemic is not just a huge challenge for global health system, especially for developing countries like Nigeria. It is also a socio-economic problem, which is why if we do nothing to scale up eye care service, more and more people will be impacted negatively, with clear detriment to their mobility and quality of life. I am therefore calling on the Nigerian Optometric Association to step up your campaign in making both the people in authority and society at large appreciate the role that eye care services play in the national economy.
Ill eye health is not categorized as a killer disease, but we all know that eye health has a lot to do with quality of life, has a lot to do with the economic situation, security in any health system in the nation and even internationally. And so what this conference definitely will bring forth solutions to addressing all these issues.
With a projection that puts an estimated 50% of global population likely to experience visual impairment by the year 2050, they called for policies to ensure eye care services are accessible and available to all.
For quality eye care to reach target population and produce the desired outcome, it must be available, affordable, and accessible to all.
We will continue to, push for prevention of needless blindness in all the local governments, in the state and the national level. Just like we appeal to the representative to the governor that optometry be employed at all the local governments and all the healthcare facilities, because it will help to reduce the gap in terms of reaching out to people, women and children that are actually being plagued by, visual impairment and blindness, myopia, which is becoming 50% of the reason for needless blindness in the world today.
When we partner with other healthcare professions, it's a form of advocacy. When optometrists work in a hospital setting, right, that is a place where other healthcare professionals will be able to measure the value you bring to, healthcare is a comprehensive thing. It's not just about eye. Even the eye connects all other physiological to all other ailments in the body. So other healthcare professionals in a teamwork will be observing the contribution of the optometrist in that healthcare team. If the value he brings is significant, it's a huge advocacy you have done, because those other people will not talk to the other person. So I advise my colleagues, whatever you earn, stand up and defend not just yourself, to defend the status of the profession.
High point of the event was an exhibition tour and musical display to lighten the mood of invited guests. Available statistics by experts at this workshop show that 1 out of every 8 Nigerians is living with disability. This group of persons have also not been spared in the increasing cases of sexual and gender-based violence in the country. To ensure an inclusive society where persons with disability are equipped with relevant knowledge for self-defense, this workshop by the Women's Rights and Health Project became necessary.
Most times, most of them, they just they face violence and they just stay, they just endure until death, which is really bad. So RAP is working with AWDF to ensure that women living with disabilities are empowered with knowledge. They are sensitized on their rights, on SGBV, and how to report violence. We need people to know that you have rights. We're in a patriarchal society where women do not believe that they have rights. They do not believe that they can say no to certain things. So this is a platform for us to teach them, for us to sensitize them, for them to know that they have rights as human beings. And if they are not in a comfortable situation, they can do something about it. They don't have to feel powerless about it and sit back. They can always do something about it.
Issues of child rape and how to further empower persons with disability also came to the fore.
The perpetrators need to know that it is a crime, first and foremost. They should know that it is a crime to rape a child. Of course they know. But because of how helpless the society make it seem for women they feel that they can do whatever it is they want to do and get away with it. So awareness raising is number one. They need to know the law on SGBV.
Imagine that there was no interpreter today and they're just looking at what people are saying. They'll be looking like, what's going on here? So you see, thank God for the work of interpreters that help them. So they need it. They really need these people in different aspects of, like places I mentioned earlier, and so many other places need interpreters. They mentioned that they don't have jobs, that government should help create workshops, seminar trainings where they'll teach them on, like one of them said she loves to sew, but she doesn't have the money to pay. Where she went, they don't have 70,000, somewhere they don't have 40,000. Some of them, the truth is that some of these people, their parents don't even care about them. They've given up. They're like, I beg, this one will amount to nothing in the society. But it's not true. One of the ladies that was blind also said that she bakes cakes too. They need this knowledge, this talent, this craft. They need them. So there are different things that the government can really come up to help them organize training like this so that they can learn these things so as to put food on their table. When they are able to do this, when they get married, ready with a female, it will be very difficult for them to encounter gender-based violence, for them to face any form of violence from their partners, because they have something that they are doing. Imagine when let's say you sew, it will be hard for your partner to come and tell you because you're busy.
Initially, I knew about gender-based violence, but with this program, I got more exposed to things I didn't know before, and even more places that I could not only go to, but refer people to. So it helped us to also understand and improvise with things that we're actually doing. Like in our cluster in Alimosh, I'm the vice chairman and the woman leader. We're actually planning a give back to the community in a way where we can also give back, not only ask from the community, but giving back to the community. So because of this program, we have been able to improvise our programs, and including sensitizing people, the public, the community on gender-based violence. Also, adding the fact that, they need how to learn self-defense, working with NGOs, partnering with NGOs that will be able to teach these communities, these women in the community, on how to know how to use self-defense to protect themselves.
The expectation that this will provide service to humanity, especially those unborn. I hereby declare this.
Rotary Club International for years has been known for its humanitarian services and exploits in the global health arena. This was again demonstrated with the recent building and commissioning of neonatal ward at the Ifako-Ijayi Hospital by the Rotary Club of Omole Golden.
We realized that they had stacks of incubators and phototherapies lying on the floor. Even those ones that we gave a year before were just stacked somewhere. There was no space to put them. And well, it's not their fault because the space they have was very, very small. And I felt, instead of bringing incubators every year and they don't have a space to put them, why don't we look at giving them a building where they can put it? Even though Rotary does not support construction, but I'm in the construction industry. I'm an estate surveyor and valuer. It's very easy for me to look at how we can get a space and put up such thing. So it now occurred that it's something we could do. And that is the beginning of the journey.
I'm happy that in my own tenure as the president, this project that was conceptualized 2 years before my tenure is now a reality.
Static, I'm excited, I'm more inspired, and I'm looking forward to the many big things that we're going to do as a club in Rotary Club of Omole Golden.
For the hospital management, it is a dream come true that will positively impact society.
Decide to ride the horse within me. There is enough space for the horse. So that tells you the amount of joy in me for witnessing, because the project was the foundation was laid on the 3rd of April 2019 during my tenure, and I'm so glad that it's been completed today during my tenure. What Rotary Club has done today, it will go a long way into reducing neonatal mortality.
It's a dream fulfilled. It's an expectation that has become a reality. And it tells us that there's a lot of work for us to do in the future because it has expanded our scope of activity.
The praise worship and prayers set the tone for the day's event, which was the launch of the book, Are You Satisfied? Written by Rukome Emmanuel Otuonio, a person living with cerebral palsy.
We launch the book, Are You Satisfied? In the name of Jesus.
His elated father and close associate spoke to our crew about the challenges of Rukume that birthed the book.
Rukume Emmanuel Otuonio was born in 1995 and was diagnosed with cerebral palsy at infancy. The condition greatly impaired his motor movements and reflexes, but graciously his cognitive and learning senses were not affected. By the special grace of the Almighty God, he was able to successfully complete his primary and secondary education in Nigeria in 2016 at the age of 21, despite all of the challenges that life has thrown at him. As a determined young man in an unconducive environment, he gained admission to the Pan-Atlantic University, Lagos, where he did 2 years in the Mass Communications Department. Rukume is a budding writer whose passion has always been to impact the world through his imaginative and creative writing. I stand here in awe of this young man who, despite his challenges and his disabilities, has been able to put this book together.
It's known that he's a determined young man, and when he said he wanted to write, because most of the time he's by his computer, because he will not be able to go out and all of that, and when he said he wanted to write, we encouraged him to go ahead and write. Like Rukume wrote in his book, you must put a purpose to your life, and once you put a purpose to your life, you are able to break glass ceilings, because what limits man, what limits all of us is fear. It limits us, but once you are courageous, you are able to break the bounds and make a meaning to your life. So I advise everyone that is challenging one way or the other to look beyond the disabilities, because even the environment we live in limits you.
It's an opportunity for him because I know that he's a statement in God's hand and it's just beginning. Because I promise you the next book launch will be bigger than this.
The first thing is to learn from the book itself, because he's told us in the book that the first thing is accept yourself for who you are, the way you have found yourself. Once you accept yourself the way you have found yourself, then you have laid the foundation to be able to move forward. So for every person who is physically challenged, the first thing is that accept what you have. And then have faith in yourself, be determined, be courageous, and then you can move forward. But in moving forward, we also need government to support them, to provide the right environment for them to be able to thrive.
Infertility is a major problem that has broken many marriages, led to stigmatization of many women, and the growth of baby factories in most parts of Nigeria. For families experiencing this challenge, this third fertility conference with the theme Bridging the Gap in Infertility was held.
I waited for 8 years, and after which God gave me the word to go out and encourage others that if I've been able to go through it, I should be able to pass the same grace onto others. That was how we started with a few, families. And over the last 10 years, we've been standing. We don't give children, we are not hospitals, but we counsel families. And we do this through life, family life. We do this through spiritual, and we do this through medical. So we counsel people on the best way and option to take in getting pregnant.
The major things that have been discussed today is that families trusting to have their own children should not be ashamed. They should speak out. They should seek for help. And in seeking for help, especially for the woman, to seek for help early. Some of the things we also learned during this program is that there are so many things in nature that can help fertility. The food we eat, the change of lifestyle, stress-free life, that is having supports, husband and wife working together. That alone can remove the stress of having to wait to have their own children.
So what this program is all about is we identifying the problem, which we know, but more importantly, as be able to create access for such women to be able to get solutions to their various fertility challenges. 95% of the facilities that offer treatment or solutions are in the private sector. There are only about five public sector facilities. So that creates a huge out-of-pocket expense for women, and necessarily they can't. Unfortunately, they can't access care. So Para Foundation is one of the organizations that are trying to bridge that gap.
There's no doubt infertility is a big burden for us here in Nigeria. But I think the way that we can really deal with it is by education. We have to start educating our girls very early, when they're in school, about the potential causes of infertility and how they can prevent it. Reducing the risk of things like sexually transmitted infections, because that causes blocked tubes, and that definitely causes infertility. Unfortunately, we know that because we know that it's not just the women that can have challenges; men can have challenges too. And globally, we know that sperm is not as good all over the world. It's getting the sperm parameters are getting a bit more reduced. So again, ensuring that our men stay healthy, keep their weight down, minimize alcohol, minimize smoking.
Christiana Akinkumi and her 4 children enjoyed a good life until the demise of her husband in 2019. Her husband died after a prolonged illness that took away the family's savings.
Since my husband late, things are so difficult for me because he left children for me and they are in a higher institution. To pay school fees na wahala, to feed them in the school na wahala, to pay for their house rent in the school na wahala. So me too, my business is not going well. I cannot feed myself very well. Please, I need help of society, church, government should come to my aid.
The situation of Christiana represents that of several widows out there in the world, especially in developing countries like Nigeria, where the harsh economic realities have made things worse.
The government should come up with policies that will protect widows, that will encourage or make it compulsory for all men to use their wives as the next of kin, to all their documentations, and also come up with policies that will enhance a better life for widows and their children. And they can also come up with policies of even free education for children of widows in our society, because they are very vulnerable. They never bargain to be widows. So I think it's a period of sober reflection for every one of us.
Most times, they are accused of what they don't know anything about. And when they go through all this deprivation and sufferings, it rubs off on the children they have. In a way, that translates to the problems we have in the society, because a woman under that kind of trauma cannot be in the right frame of mind to bring up the children.
Beyond the harsh economic situation, the harmful cultural practices widows are subjected to is an issue for stakeholders.
Every man that dies, his wife is automatically a suspect. And I keep wondering, how is it that when women die, their husbands are not suspects? It's not as if there are no laws guiding as how widows should be treated. It's not as if there are no laws speaking an end to these harmful widowhood rights and traditions. But these laws are hardly ever implemented. And so we have widows who, as we speak, are being made to drink the water that was used to bathe their husbands, widows that are forced to shave their hairs, widows that are forced to sit down on the bed floor for months on end. So some women are also forced to marry their husbands' brothers or relatives, whether they like it or not. Why on earth would this still be happening in 21st century Nigeria?
The International Widows' Day is celebrated 23rd of June every year as designated by the United Nations to draw attention to the experiences of widows and galvanize support for them. Director General of the World Health Organization, WHO, the World Intellectual Property Organization, and the World Trade Organization have agreed to enhance their support to members battling COVID-19 by collaborating on a series of workshops to augment the flow of information on the pandemic and by implementing a joint platform for tripartite technical assistance to member governments relating to their needs for medical technologies. The three global bodies have since 2009 stepped up their cooperation and practical coordination on issues relating to public health. Welcome back. Arthritis, also known as inflammation of the joints, causes pain and stiffness that worsen with age. Different types of arthritis exist, each with different causes, including wear and tear, infections, and underlying diseases. The burden of arthritis in Nigeria is high, with more than 1.5 million cases recorded annually. Treatment can help, but the condition is not curable. I spoke with a consultant orthopedic and trauma surgeon on this topical issue, Dr. Ishak Ojudu. Dr. Ojudu will also be telling us how regenerative medicine can help people with this condition.
Before we go into the treatment or the prevention, we must know the risk factors. What are the likely causes or risk factors responsible for arthritis? It's divided into two groups: modifiable risk factors and non-modifiable risk factors. The modifiable risk factors are those that you have control over. Okay, and this will be obesity, injury to the joints, and injury and obesity, so to say. So these are the things that you can control, or other comorbid factors. Then the non-modifiable factors will be your age, because as you grow old, you have the tendency to develop arthritis. Then most importantly is hereditary, the genetics, what you have inherited from your parents will also determine whether you come down with arthritis or not. And then malalignment of the joint. If you are born with bow legs and it's not properly taken care of, you have the tendency to develop arthritis. Age or sex, if you are male, before 50 years, male have predominant incidence of arthritis, whereas after 50 years, females are more prone to develop arthritis. These are non-modifiable factors. So arthritis incidence will be determined by the combination of these modifiable and non-modifiable factors. The arthritis develop more in old age. Apart from the joint, the arthritis that can be seen after injury. If you have an accident, you suffered the fractures around the joints. If it's not properly managed, you can now develop arthritis. But mostly, it's commoner in the older age group. Lifestyle modification, you need to involve in regular physical exercises. You need to have to do weight management program, especially what we call body mass index. Your body mass index must be within acceptable limits for you to ensure that your joints will not be affected on the long run. So physical exercise, good nutrition go a long way to minimize in this incidence of arthritis generally. I want to take us through the whole steps in managing arthritic pain. As we age, people tend to have arthritic joints. Arthritis develop more in old age. Apart from the arthritis that can be seen after injury. If you have an accident, you suffered the fractures around the joints. If it's not properly managed, you can now develop arthritis. But mostly, it's commoner in the older age group. So we've seen in the years back that the treatments offered and the last option of treatment, which is surgical intervention. Most people who don't want surgery, okay, or they are not qualified as a surgical candidate for surgical intervention. So that's a gap that we realize that we need to fill as an institution, and that's why we are bringing this modality of treatment to the Nigerian public. This one is a new therapy that will go a long way in alleviating the pains that patients suffer. First, you need to be aware that arthritis is not a death sentence. It can occur in any joint. It can affect any age group. So that is the first thing, that if you have arthritis, it's not a death sentence, can be minimized, the pain can be minimized, and you can have quality of life. Secondly, is lifestyle modification. You need to reduce your weight if you are overweight. You need to engage in regular physical exercise, and then you need to control systemic morbidities like hypertension, diabetes, which will also impact on your ability to function. So after that, when we see you, evaluate you, we will refer you to a physiotherapist to have an assessment and put you on muscle strengthening exercises and then infrared modalities and all that. So after the physiotherapy intervention, we'll place you on medications. As we know, all drugs are also poisons to the body if they are not used appropriately, in correct form and appropriate duration. So we'll place you on medications. We have various forms of medications like non-steroid anti-inflammatory drugs, like viscose supplements, chondroitin and glucosamine tablets. Can place you on antidepressants, can place you on muscle relaxants. So combination of these drugs will be determined by the evaluation of the patient. So after these drugs, we will monitor you 2, 4, 6 weeks. If there is no relief, then we can ask you to be using joint support devices, knee brace, ankle brace, so as to support the function of that joint. If this does not work, then we'll go on to intra-articular injection. Intra-articular injection means we are going to inject some form of injection into the joint, and there are also various forms of injections. First is viscose supplement. You can inject hyaluronic acid, which is an example of a viscose supplement. Then you can inject steroids, which is very common. Most people have had steroid injection in one form or the other. Then there is a new therapy called prolotherapy. It's a combination of 50% dextrose and normal saline in appropriate medium, and then you inject it in a weekly manner for about 3-4 weeks and see the response. So the new therapy we are introducing now is called regenerative modalities, that is non-invasive also. It's also a form of non-invasive or non-surgical method of treating arthritis, in which we collect your blood sample and then process it in a machine and then re-inject it back into your joint. The second form is to collect your fat process it, and then inject it via ultrasound guidance. And that is the cross of this new method of treatment, which will go a long way in alleviating the pain and improve the quality of life of patients. Regenerative therapies is not only meant for arthritis, it's also, you can also cater for sport injuries. Some people that suffer tendon injuries, ligament injuries, you can inject this treatment and then it will aid in the healing process faster than if they go through the normal casting and analgesics.
Somebody asked a question, is it a permanent solution? How much is it coming from time to time? How does it...
It is not a permanent solution. It's just a stopgap. It's just for you to have quality of life. Okay. Once we say degenerative disease, it means it presupposes that that degeneration will continue, but we don't want you to be living in pains. Okay. So if you give you the regenerative therapy, it will go a long way to minimize or to slow down the progression of that degeneration. So in the long run, you might still need surgical intervention, but you must have had a considerable number of years.
If you're just joining us, it's Etafe on AIT. Now I'll be taking you to our nutrition segment. Eggplant, or Solanum melongena, is a plant species in the nightshade family, and it is grown worldwide for its edible fruits. In Africa, it is a seasonal food crop known as African eggplant or garden egg. The garden egg is a type of eggplant. It is a small white fruit with a teardrop or roundish shape, valued for its bitterness. Other popular colors in Africa are the green and purple types of eggplants. Botanically, eggplants are classified as berries because the fruit contains numerous small, soft, edible seeds that taste bitter because they are covered with nicotinoid alkaloids. Technically, garden eggs are called fruits but are harvested and utilized as vegetables. The glossy, spongy, absorbent fruit is a versatile vegetable, and different cultivars of the plant produce fruits of different sizes, shapes, and colors. The purple color is, however, more popular worldwide. It could also be oval, long, melon-shaped, and even teardrop shape. The eggplant is believed to have originated from India more than 1,500 years ago and has been cultivated in southern and eastern Asia since prehistoric times. It has been an ingredient in traditional medicine for thousands of years. Ancient Indian medicine practitioners used white eggplant to treat diabetes and the root to relieve asthma. As trade routes opened, eggplant was introduced to Europe by the Arabs and transported to Africa by the Persians. Raw eggplant has a rich, meaty inside that takes on a creamy consistency when you cook it, and it is used in the cuisines of many countries. The texture makes it a good substitute for meat. Eggplant is versatile and can be steamed, fried, roasted, grilled, baked, or stewed, but many eggplant dishes are sauces made by mash. In China, the fruit is so popular that a woman must have at least 12 eggplant recipes prior to her wedding day as part of her bride price. 100-gram serving of raw eggplant supplies 25 calories of energy, carbohydrate 2% of daily value with 3 grams of dietary fiber, protein 2% of daily value. It also contains vitamins such as vitamin A, B6, vitamin C, and vitamin K in appreciable amounts, and minerals such as calcium, iron, magnesium, phosphorus, and potassium. Eggplants have antioxidant properties which help to protect the body cells against damage. It is also high in natural plant chemicals called polyphenols, which may help cells to process sugar in diabetic patients. on our clinical segment will give you powerful health tips to stay healthy.
Did you know that excessive use of medicine damages the liver and the kidney? There are lots of fake drugs in the market. Please buy your medicines from reputable pharmacy shops. Please, drink plenty of water, minimum of at least 2 liters of water in a day. Brush your teeth twice daily with toothbrush and toothpaste. Exercise regularly to keep fit. And please, very important, always wash your hands with soap and water.
Please join us on our perception segment, Your Opinion Counts, to improve human lives and the Nigerian health sector.
Successive governments in Nigeria, they have failed to ensure that the health sector, they place it on a high pedestal. We have the resources, but we don't have the equipment, we don't have the enabling environment for them to be able to perform at the optimal level. And that is why you see our leaders, they leave the shores of this country to go abroad to source for quality healthcare services, which is very, very wrong. Which is wrong. They're supposed to improve on what we have in this country. They're supposed to bring the expertise and what they have seen and what they always see in abroad back to Nigeria.
This is where we draw the curtain on the show today. Please join us same time next week for another exciting edition of the program. My name is Ushuomowa Daniels. Please do not forget that you have only one life to live, and a healthy body helps you accomplish your purpose. Invest in your health by seeking information and going for regular check-up.